Look at all these faces.
Hey, everybody. Good to see
Hey,
you.
Someone has their profile picture as a meow meow. That's adorable.
That is adorable.
Yeah, I guess 7:10. Let's get her going. Without further ado, welcome back for those who have been sticking with us every Thursday night. Welcome for anyone new who is joining us on the call. Welcome back. Welcome forward. Thank you for joining us tonight for a fantastic session planned by Chess and Inspiration with the help of Cottrells and the expertise of Dr. Mike here. This is our fifth installment, Joan?
I think it is five.
Fifth installment in our spring webinar series. And we're still only about halfway through. We still got a bunch more. We still have a bunch coming in the pipeline. This, like I mentioned at the beginning of the call, if anybody missed it, this session is being recorded. However, only the host and the co-host will be captured in the recording. Eric usually likes to cut it down for YouTube a little bit, cut our beginning banter out of the way. And it'll be released to everybody on the call, including the virtual evaluation in the chat at the end, and as well as via email. If at all possible, we do like to record attendance just to see who was on here. If you wouldn't mind, if your device name is iPhone or tablet, if you wouldn't mind renaming it to, even if it's just like your initials, if you're concerned about privacy, that's totally cool too. As Mike goes through his presentation, he's going to demonstrate a particular technique. And during that technique demonstration, please feel free to ask questions in the chat, and we will answer them as fast as we can through the demonstration. If you want to wait and hold a question for the end, that is totally cool too. And that's what I've got for my intro. But first, we're going to get to a few polls just so we can kind of help Mike direct where he's going for the night. So I'm going to go ahead and hit that share button on her. All right, can everybody see that? That's not that spinning wheel. That's for later. So I'm going to go ahead and start this poll. We only have 3. These are super easy polls for those who have done this in the past. I'm going to send a text message to 520-433-4098. Someone is already on top of this. You're going to vote 1 for yes, vote 2 for no, 3 for maybe, because maybe you've used the tape in the past and you just didn't know. 40% yes, 60 no. 57-43. Make the bars move. Make the bars move. Six, 4, 50-50.
Chris, remind me of the number. Someone asked what it is. I'll type it in.
520-433-4098.
Thank you.
You send a text to that number with the number 1 for a yes, the number 2 for a no, and 3 for maybe. Back 50-50, 54. Ooh. Still seeing it move. Thank you for that, John.
Yep.
This is a good spread.
Yes. Interesting.
Oh. It's like, isn't it like watching the odds at like a horse race?
Right. Ooh.
When do you throw your money behind the prize steed?
That's right.
All right, I like that there. Hit
Close.
the stop button. I know it's close. Hit stop. We're going to go to the next question. This is an open-ended question. So maybe some people have had experiences with Kinesio tape, or they haven't. So just by as simple as texting 520-433-4098. What experiences have you had with K-tape? That is indeed a response. If you've had none, that is an experience. None, which is great. That's why you're here. Physical therapist used it on my arm. It helped joint pain. Saw this in an HFA meeting.
Ah,
Someone in here is a veteran, retired occupational therapist. Sports during first, joint stability, yup. Used it once. Back pain. Oh. Back pain.
Huh. I didn't know Massage Envy did it. That's interesting.
Really?
Yeah. Well, that's what someone said.
Oh, I didn't even see that one. There it is. Ooh. Actually, where did Janet see it? That there was actually Kinesio tape was just featured on Good Morning America. Was it
Yeah,
yesterday,
Good
the day
Morning
before?
Yes. Yep. I think it was yesterday.
Daughter uses it for joint pain.
Oh, they charge extra for it. That sounds right, Donna, that they do charge extra for it at Massage Envy.
this is a Zoom meeting, guys.
Jeanette, leave it to you. Wow, 15
They
bucks.
know who I am. Everybody does. Everybody. No. How do they know you?
I'm known by people.
In the hemophilia community.
Yes.
Really?
Yes. I'm known in the hemophilia. If she doesn't know me, that means she does not know the hemophilia community. Because I'm known in the hemophilia community.
All right, I like all of these
Where?
responses. We hit the button, and then we've the last poll that we got. Hit the start button. I'm going to vote by texting 520-433-4098. What specific techniques would you like to learn? Or I threw this in here. What areas of the body do you feel need support? Maybe need some help? And you can send 2 texts, and this is going to be a word cloud. So you can text this number twice with 2 different responses. And if there's multiple responses of the same response, the word gets bigger, such as, that's why knee is really big right now. Ankles, knees, all about those ankles, knees, shins, elbows. This is a song. Carpal tunnel. I don't think the song has that, but in our line of work, potentially it should. Foot and ankle support. Knees. Shoulders. Someone threw their arm out playing baseball. Now they need Tommy John surgery. Pain reduction support. These are all fantastic.
They really are.
Ankles and knees really seem to be the hot.
Yep.
Bicep. Okay. Loving these.
Great.
Let's see if any couple more filter in. Elbows. I suppose at some point, like, I know people that can't fully extend,
Yeah.
or they can't get, an elbow over the shoulder line. That gets tough. And as you get older, things change.
Thumb.
Right.
Wow.
Probably connected to wrists and carpal tunnel and
Yep.
oh, okay. That's one way to put it. All right. Love these. So those are the 3 polls we have. And before we get to Mike and his content, we got to pick the winners from last week's. So thank you to all of those who participated in the pain session with Angie last week. And we're going to pick a winner, 2 winners real quick from the evaluations. I'm going to hit the old spin button. I'm providing the music. Do, 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 do. Amy.
Woo! Nice job, Amy.
Hit the done button. And then Amy gets popped out. Here we go. Here comes the second winner. Do, do, do. Melody.
Melanie.
I love the confetti.
I do too. Fun.
All right. Got those written down.
Hi, everybody. It's good to see you all this evening. So I'm happy to tell you that we have Michael Zalitsky with us again this week. And he is a physical therapist in New Jersey. He's living with severe hemophilia A. He is a national speaker for HFA and Coalition for Hemo B, presenting an exercise, pool, and land therapy for over 5 years. His YouTube channel is HemoDoc, and his goal is to improve the quality of life for hemophiliacs. And I guess I just wanted to tell you, I don't know if any of you remember Sarah Chan, but she was the person that I think we were in. I can't remember if we were in San Diego or Florida, but I went to see Mike. I met Mike there, and we just love Sarah. And I guess it's just a nice way to remember her. And I love that she brought us together with Michael. Without further ado, we're going to turn it over to Michael. Do your thing, Mike.
Hi, everyone. All right. Can everyone see me? I just want to make sure.
Looking
You
good.
can see me, right?
Yes.
All right. So, I haven't done this in about a year now since everything's been closed. So I might be a little rusty, but usually I like to really just introduce myself, kind of go through my little history of living with hemophilia, and then get into the presentation and make it very interactive. So I'm happy that you guys were all given a roll of KT tape for home. That's the best we can do since I'm not physically there to kind of tape you guys up. But I have severe hemophilia. I am a physical therapist. I live out in Old Bridge. And really for, the first 25 years of my life, I never met anybody with hemophilia outside of myself. And I moved to Pittsburgh for PT school. I was applying to some scholarships. And then I came across, one lady who told me, you should get together with the Western PA chapter for hemophilia. And I went there, and the first person I met, gentleman by the name of EJ, who kind of got me connected with Cottrell's. And, he told me about NHF and the scholarship they were running. So I've never been to a bleeding disorder conference or never met anybody else besides him. I applied, and then I was granted to go to NHF, met a few people. And from there, I was given the opportunity to present at HFA in Las Vegas the following year, where I talked a little bit about aquatic therapy. And, since that time, really, I became a physical therapist. I really wanted to focus a lot of, workouts and exercise regimens on individuals with bleeding disorders, because I know when I was growing up, that wasn't a huge focus. People didn't really know what exercise to really give. And they were just saying, yeah, you can play sports, but they didn't really give specific workouts. They didn't really give you specifics on what to do with the joint bleed. So that's kind of what I wanted to focus on. Fast forward a couple of years, I started doing more and more talks with HFA on pain management techniques, just generalized exercise. And then for the New York City chapter, they kind of gave me, why don't you present on something, whatever you think would be good. So I started using KT taping in my clinic quite a bit, and the patients were getting awesome results. I said, why not try it for the bleeding disorder community? And a lot of patients, a lot of individuals there, that I taped up. The following day, I got a message from one gentleman who said, this is the best my knee has felt in 3 years. I had a knee replacement. I literally could walk without pain for the first time, and it was amazing. So I shared that feedback with HFA. And, from that point on, that was pretty much the only presentation I've been giving the last 2 years, with a little bit of aquatics, a little bit of land-based, but it's been a huge success. And individuals always ask, like, where should I, get the videos? And I said, just check YouTube, but I didn't really have a direct link. So I started recording them. I put them on YouTube channel, which is HemoDoc. That, the recordings are not professional or anything. They're just kind of like, random people. I'll say, hey, can you record this real quick? So they're definitely not the best, but they're a good guidance. And what I'd like to do today is really try to go through the benefits of kinesiology taping, how it can benefit, your kids, yourselves, your spouses, how to apply it correctly, and, really just give you guys some ways to control pain without opioids, without bed rest, because what happens is we get a joint bleed and we just want to rest it. We don't want to put any pressure. So if I injure my left ankle, I'm going to be putting all my pressure walking on my right. And that leads to right ankle pain or right hip pain compensations. Or I'm just completely on crutches. I'm not weight bearing. And then we start getting a lot of atrophy in that joint. And what happens is we never re-strengthen that joint, whether it's the ankle, wrist, elbow, shoulder. We just kind of rest it, and then the pain goes away slowly. And then we re-aggravate it. And that happens time and time again. And that's what we start to call a target joint. But really, I wrote an article about this in the Penn article for Lori Kelly a while back. If we can re-strengthen these joints that get injured initially, we can prevent target joints, because everyone gets some sort of target joints, whether it's chronic sprainers and stuff like that, but we can really help with that. So I'm happy that 50% of the people have used KT tape, because I can kind of expand on that. And I'm happy that the other 50% did not, because I can teach you all about it and hopefully help you tremendously. I did a symposium for Coalition of Hem B a couple of summers ago, and this one young girl that I met with hemophilia as well as EDS, I taught her how to tape, and she said it was life-changing for her. She would tape her shins, ankles, hips, knees, everything I taught her, and it really helped her control the pain. So really, there's no reason not to use the tape. The only time you shouldn't tape yourself is if you have a blood clot, which you don't want to stimulate anything to go up to the lungs. Like any adhesive, if anyone has allergic reactions, like a Band-Aid, you can get that with the tape as well. They do say you can leave the tape on for up to 5 days, but if the skin gets red or itchy, you want to take it off. And anyone who has like frail skin or, like hairy arms like this, when you take the tape off, it will pull some hair out. So you get a free wax out of it. So, which is good, but it could be painful. So if you're going to tape yourself, quite consistently, a lot of my patients will kind of just shave. Like if I tape my wrist, a lot of patients will just shave the wrist a little bit just so the tape can stick well. If you have lotion or massage oils on there, the tape will not stick as well. So you really want it to be on a really clean surface. In the wintertime with the ladies, when your hair is a little stubbly, that's actually how it will stick very nicely. Whereas if there's a lot of hair, it's not going to stick whatsoever. If there's no hair, it'll still stick, but like a little stubbles, it really grabs pretty tightly. And, the way it works, it really can help with stability. It can help with swelling reduction. It can help with pain control. It can help a muscle contract if you have a lot of weakness. So if you have like a foot drop or your shoulder, like you can only get it up this high, it can help stimulate the muscle contraction to be a little bit stronger. Or if your muscles are super tight, causing spasms or headaches for like neck pain, neck tension, it can help relax the muscles. So what I read in the polls was, I want to learn how to tape my thumb, wrist, elbow, shoulder, neck, low back, hip, knee, and ankle. So luckily for you, we can do that in the 40 minutes we have. It's gonna be hard for me to scroll through all the participants. So I'm just gonna kind of be focusing on my screen. But if anyone has a question, maybe just type it in. And what I'll do is after I show like the wrist, I'll say any questions, and we'll kind of move on to the elbow, move on to the shoulder, move on to different body regions. But the tape is tremendous. I've used it for myself. It gives immediate pain relief. I saw some people commented that they've been in my sessions before, which is awesome. A lot of these symposiums, people come up limping with a cane and their gait is completely affected. And I tape them and they're like, this feels amazing. I was in California and a Texas symposium, and someone said that was me. So thank you. I was in a California symposium and I taped this gentleman's knees, and he was salsa dancing all night long. I did a couple, like some people had severe swelling after a bleed. I taped them up for swelling, and the next day they said how much better it was. So it's like too good to be true, but it really works. So I'm happy that, we have a great group here. Thank you guys for inviting me out. And it was the symposium in San Diego. I was out to dinner and I met the young lady and she told me about the organization. And I really have never heard of you guys. And then as soon as she said that you guys have symposiums in Austin, Texas, I'm like, I got to reach out because I've never been there. Love to go. So, we communicated a little bit. We did an event last year on exercise. I'm happy to be back to start up this year. Hopefully things open up. I'm used to traveling like almost every weekend, and being home is a little weird for me, but it's good to at least do something on Zoom. After this, you guys can always reach out to me. I get a lot of messages on Facebook and Instagram, and I do the best I can to kind of, share some videos, share some general content, some basic stretching and stuff that you guys can do from home. So wherever you're located, just use me as a resource. I'm here to help you guys out. So thanks again. So the first thing we're going to go through is everyone have their tape kind of ready, like handy nearby. If not, try to get it nearby. And if you have a pair of scissors, try to get your scissors nearby. So the tape can come. A lot of questions I get is like, also, where can I get it from? I mean, Amazon is really the cheapest. Just type in kinesiology tape. The black for me is really sticks the best. The baby blue, not so much, but you know, there's so many different brands, and there's different techniques. So what I'm going to do first thing we're going to do is really go over swelling. So you always want to round the edges. For the sake of time, I'm not going to round every single edge, but you know, this is a rounded edge. So this just helps it stick a little bit better. So I'm going to round the other edge. Okay. First thing we're going to kind of go over is how do we help reduce swelling? So what we want to do is we want to create a head of the fan, which is going to be about this big from the tape. And the other 80% of the tape, we're going to cut right up the middle. And we're going to cut it up. It's also good to have good scissors. I know sometimes I get in these hotels to do these presentations and I get carpal tunnel myself from cutting with dull scissors for like an hour. It's a lot of prep. So what I'm doing here is really just kind of cutting up the middle. And you're going to see 4 little kind of fingers, right? So we have the tail and we have 4 little fingers. Someone gets a bleed, what I recommend is really you want to try early range of motion, early weight bearing, you know, ice and elevation. You don't want to just lay in bed for 4 days because that's how you develop muscle atrophy. But if you're in pain and you can't walk, it's hard to, you know, be active. What we want to do first is control the swelling. This is also very beneficial if anyone has contusions like bleeds. If you have a really thick, like a hematoma or really bad bone bruise, the tape will actually help draw that blood out. So it's important to know when to use a lot of tension, when to use little tension or no tension whatsoever. When we're trying to control swelling, we want to use little to no tension. So I'm going to pretend like I have a forearm bleed right over here, right? So here's my bruising. I have big swelling. You know, this is what I want to help control. You don't want to really try to touch the tape. So this is how I'm going to kind of break it up. And this is also great for the knee and the ankle. And the elbows are areas where you get a lot of tension. So what we want to do is we want to put the fan on top of the area of the swelling. So if my swelling's right here, I'm putting the fan on top. Now, I want to use no tension whatsoever. What we want is wherever the bruise is or the swelling, we want to put the fan kind of over it. So I'm going to take the piece of tape, and this is how you guys can kind of tape yourselves. And I'm just letting the tape come off, right? So I'm really just letting the tape come off. And then my finger is rubbing over the tape to just help activate it. You want to, again, try not to touch the tape because that will not stick as well. So now I have a fan. I'm kind of like Spider-Man. A lot of times, someone asks about carpal tunnel. You can do the same thing right on your wrist because carpal tunnel is swelling of the median nerve, which causes numbness and tingling to the thenar eminence, which is right over here, and sharp pains to the fingertips. So you can use that, pretty much put the fan right on top. But for the sake of the forearm, these fans, what it does, it creates a negative pressure gradient. It pushes the fluid up. And, you know, you might be swollen like Thursday night. Friday morning, you wake up, it should be a lot less. So if anyone has any swelling, cut yourself a fan tape, put it on, no tension while we kind of go through this. And if you have like a huge amount of swelling, you could take another piece and strap it right here, and the fans can kind of cross. So I have one piece going this way, one piece going that way. If you have a huge bruise in your hip, same thing. Put the 2 pieces that kind of interlap like that. For the ankle, it's great. And what I didn't really touch upon in the beginning is the act of bracing. So when I used to play basketball, I used to roll my ankle, I would put an ankle brace on. Or if my ankle had a lot of problems, I would put a brace on. The trouble is that when you put a brace on either your ankle or your wrist, you can't move it up and down. It stays locked. When your joint stays locked, you lose range of motion. You develop scar tissue. You lose mobility. You start compensating, and it leads to a negative cascade. With the tape, which I'm going to show you guys the wrist next, it gives you stability and support ASAP, and you can move your arm up and down. The ankle, it works fantastic for. So for swelling, if anyone has any ankle swelling, knee or hip, try to put that fan tape right on. It'll definitely help reduce the swelling. You can leave it on for up to 5 days. If it gets red or itchy, take it off. I'm going to move on to the wrist real quick. I did see a question come through, but I just want to get through a couple principles, and then we'll spend a few minutes for questions. So that's how you control swelling. Now, people also get pain in their wrist, elbow. So let's say my pain in the wrist is with flexion, or I'm sorry, with extension or flexion. We want to find the area of discomfort. A lot of times for myself, I get pain in the wrist right in here, right in the joint. And a lot of times that happens if I'm like weight bearing, trying to do like a plank on my hands, or just getting up from the floor on my hands to get some wrist pain. You want to try to find where is the pain and what motion aggravates it or provokes it. So if it's in the wrist and I go up or down, I'm going to try to avoid those motions. So if my wrist hurts going into extension, I'm going to tape myself in the extended position. For stability, you want to use a lot of tension. So I'm going to pretend like I have a lot of discomfort right here, right in the joint. Everyone could see that, right? If I go down, I have no pain. That's good. If I go up, out, it hurts. Bad. We don't want pain. So what I'm going to do is keep my wrist in the extended position, and we're going to use 2 pieces of tape. These are now eye strips. So eyes are used for pain control and stability. Think of an ace bandage, but an ace bandage, if you put it too tight, you lose circulation, you take it off. Ace bandage gets very bulky. A wrist brace, your wrist stays straight, which, yeah, it's not going to hurt because you're not moving it. But if you tape yourself, you're going to find like instant stability and instant pain relief. So if you're taping yourselves, the best thing, try to stabilize one part of the tape, hold here and kind of just rip it, right? Boom. I take one piece off. We want to use one side as an anchor. There's so many ways to do this. There's no right or wrong. I could start here. I could start here. So I'm going to start right over here, right on the side. Trying to find, so I'm right in the camera. And I'm going to take one piece off, right? So what I want to do now, I want to pull. I'm trying to give myself support, right? So I'm here and I wrap it all the way around. I have instability in the wrist, which is causing pain. So I want to give myself stability. So I started from one side, went to the other, and now we're going to cross it. We're going to kind of make an X. So now I'm going to start on the opposite side, right over here. So we stabilize one side down. And I'm holding the piece of the tape. Oops. So it's not that easy to tape yourself. It's a lot easier to tape others, but definitely takes some practice. So I'm here and I'm kind of just going across. And then I'm going to take some time for questions after we finish this up. So now I'm activating the tape. So what I did was I kept myself in the painful position, which is extension. And if this was my pain, I tape myself right in this area. Now, a lot of times people get thumb pain. So what do you do with thumb pain? I'm going to cut a small piece of tape. So this would be pretty big to take my thumb. So I'm going to cut this in half. The thumb is actually the most common area for joint arthritis. Right here, it's this first CMC joint. Everyone's texting these days. You're like this all day. No wonder your thumbs have arthritis. I'm guilty of it myself. So a small piece of tape. Here's my pain. Easiest thing is if it hurts, put some tape on it. That's the lesson today. So I'm here and I'm just going to pull the tape, wrap it around. Now, I could move my thumb and be like, wow, this feels amazing. Or, okay, this pain went away, but now I still have pain over here in a different spot. So what I'm going to do is, if it hurts, put some tape on it. right over here. I'm going to be in this area and I'm just going to wrap it around. So you see, like, I want stability. So I'm using a lot of tension and I'm pulling. So now my forearm is not swollen as much because I put the swelling with no tension. My wrist has a lot more stability. Now I can still flex and extend, no problem. But doing this, I want everyone to try that on their wrist if you can while we're doing this, because you're going to feel instant, like, wow, I feel supported. I'm ready to, punch my spouse because my wrist feels so good. Sorry, should I not be saying that? So you do that. Just kidding. No punching anyone. And then for the thumb, I feel a lot more support right around this area. So I want to see if you guys can try that out. And then I don't know if Chris or Joan, if you guys want to read me the questions or you want me to go in the chat, we could take a few minutes just to see if anybody has any questions, and then I can move on to the shoulder joint.
I don't see any other questions other than the two that were the ones you're going to get to.
Okay.
Barb says,
All right.
severe factor 7, 25 years before my diagnosis, she had a total open right ankle synovectomy. So this is probably, ankles will probably be helpful coming up.
Gotcha. Did anyone have a chance, if you can, try the wrist one just so you can kind of see, the stability, because that'll help guide the principles. Did anyone try taping themselves yet?
Looks like Donna has.
Okay, cool. Working on it. Very good. Yeah, I just see, I'm on my cell phone, so I just see 4 people here. So if I could scroll.
Susan's working on it. Erica
Cool.
did it. She feels it in her wrist.
Good. So, it's not
Actually,
the easiest thing. Like, you could try to tape yourself and then it starts coming off a little bit. You saw that happen to me once. So the best way is to try, if someone's near you, try to tape them, have them tape you, try to tape yourselves. But it's definitely, just from doing that, I feel a lot more. So at my job, I'm always kind of pushing down and I get a lot of wrist pain. There's days where my wrist kills. I tape myself and it feels like I have no more pain. I had really bad wrist pain. I went for an MRI. They gave me a wrist splint. I tried to wear it, but you can't move your hand if you're straight. And for me personally, I can't work. I can't work with patients if my wrist is not able to move to kind of work on them and stuff like that. So, I love teaching it and the people get great results. So we're going to move on to the shoulder. It's not the easiest thing to kind of grasp how to do it, but that's what I'm trying to teach, the most simplistic ways. So I'm going to show you guys the wire.
Hi, Dr. Mike. I just sent you a question. Did you see it?
No, if you could just repeat it out loud, that'd be awesome.
I said, will you please explain to everyone why it's so important to keep good ROM and why it's essential during taping?
Yeah. So because what happens is if we don't keep good range of motion, we're going to get joint stiffness and contractures. And Chris was mentioning how he knows a lot of people, their elbows kind of contracted. So one of the gentlemen that I actually tape as well, one of the first people that I also met with hemophilia, his elbow's contracted. He's a young gentleman. He's in his early 30s. And I taped him for his elbow. And he said it was the first time he was able to wash his face without pain in the morning in like 7 years. That's unbelievable, just a piece of tape. So it's important we keep range of motion, because the more joint bleeds we get, the more likely we're going to develop contractures. And when we have contractures, it makes living harder. It makes it harder to do things around the house, harder to dress, bathe, shower. So maintaining good range of motion mobility early on is going to help reduce the chance of developing scar tissue, help reduce the chance of further bleeds, and reduce the chance of developing target joints.
This retired OT loves your response. Thank you.
Awesome. Yes, very activities of daily living specific. So it's got to be, we got to maintain independence. And, it's such an easy way to kind of help reduce pain right away. So thank you for that question. Now, the next one, we did a little bit of the wrist. We're going to move on to the elbow and the shoulder. So the shoulder, you really want to, this is also, I have a lot of patients come with rotator cuff tears and they have pain kind of moving their arm up, moving their arm out. This is definitely a harder one to do on your own. It's even hard to do on someone else, but this is where we're going to use a Y strip. So you have the edges rounded, and what we're going to do is cut right up the middle. Same thing, we want to leave a little bit of an area for this is the kind of the base, and we call it a Y strip because we kind of cut up the middle and we have a Y. So with the shoulder, I'm going to roll my sleeve up. You want to try to get like right around this area. You want to get the bottom of the piece right underneath the deltoid, and you want to get the pieces right around here, right around here. So if anyone's going to try this right now at home, try to raise your arm up, see if you have any pain or discomfort. A lot of times people get pain like right in the bicep, they get pain right on the top of the shoulder blade, which is the rotator cuff, or they just have stiffness, limited mobility. This extra layer of support will definitely help. Now, I can maybe mess this up because it is not easy doing it on your own, but same thing, you want to just try to rip the areas. So this piece is going to go right underneath. Tape it on. The one piece is going to go up and over. Strap it on. Make the adhesive occur. And the other piece. So here, and then I'm just giving a little bit of a pull. That was pretty good. So now I'm just trying to kind of put the tape on. So now you see it's kind of like right over the shoulder. And, you know, it just feels more supportive. A lot of times patients get pain right over here. So what I would recommend, this is like right in the bicep tendon. A lot of people that do overhead activities like electricians or just hanging light bulbs, when your arm is overhead, you can inflame the bicep tendon. So a very easy way is just take a small piece of tape, put it right around the bicep tendon, kind of wrap it around. And that definitely helps. Sometimes with EDS, a lot of the patients at these conferences also have EDS, a lot of hypermobility, hyperconnective tissue disorders. This helps with stability. So you can put this on the hip, you could put this on the knee. It just helps maintain the joint stability. And if you guys are doing this for your kids, you see a lot of the athletes wear this tape. It just helps with overall joint stability. It's like wearing a brace, but a lot more, less invasive and stuff like that. Someone asked if this will help with their bicep. Yes. Now, if the pain is like right in here, so I showed you guys stability, but if you want to relax a muscle, that's when you also don't put tension. So the bicep kind of splits into two. So if I have like inflammation or tendonitis, I would use a Y strip. I wouldn't want to use a lot of tension. I would kind of put the Y right on the base of the bicep, and I would let the tape just kind of come off, right? So the bicep splits into two. So this is where you kind of need to know where your muscles are, where they go, more like an anatomical stuff. But if someone has bicep tendonitis, you could put the tape like right like this. The two strips come down. This one kind of got wrinkly. So just pull it. Whoop. So now this is going to help relax. Someone said, how do you know? And then I didn't see the rest of it. But so
how do you know which direction the strips, the long parts you cut, should go?
Yeah, so that's where it gets a little bit confusing. If you want to support a muscle, right, you want to start the tape where the muscle starts and end the tape where the muscle ends and put medium amount of pressure. So if I want to support my bicep, I'm going to put tape here where the muscle ends. Put the tape here where the muscle starts and let it come down where it ends for support. If I want the muscle not to fire or inhibit, I want to start the tape where the muscle ends and end the tape where the muscle starts with no tension. That gets a little confusing, even for like physical therapists. So, really to keep things simple, if the muscle's really tense and tight, put the tape right over it without a lot of tension If the muscle feels very weak and unstable, put a lot of tension on it for stability and support. The best way is for the neck, right? So you don't want to tighten up your neck muscles because most people are typing like this and their traps get super tight and then you get a kink in the neck, and that kink in the neck causes a headache. So to relax the muscle from firing in the neck, which I do a lot of upper trap inhibition. The upper trap runs from here all the way up to your ear. I would put the tape right over here and I would kind of let it come up with no tension right up to my ear. And that's it. I would just help relax the muscle. So that's the confusing portion of it. That's pretty much how you kind of organize it. But
Michael, someone asked, I had an open left bicep brachii muscle biopsy in 2019. Is there any taping to help prevent the scar tissue from becoming aggravated while supporting the remaining muscle?
yeah, so actually, I did a teen event and teens were really cool. They didn't really have pain, which was awesome to hear. However, a lot of them had port removals, and still had a lot of scar tissue. So there are taping techniques you can use to reduce scar tissue. What I'll do is, let's just say I have a scar right here. You want to take a piece of tape. This is just scrap. So I'm going to put, here's my scar. You put the piece of tape right over the scar, no tension. Now, what we do from there, we cut small pieces of tape. So now I have one small piece. You want to put the tape on the outside and you want to pull it so kind of boom, boom, zigzags. And then you take another piece of tape, same thing. You go from the opposite side. You go here, goes boom, boom, zigzags. So the goal is that we kind of spread that scar apart to help. Now, if someone had a surgery like a knee replacement, you don't want to do that the first 4 to 6 weeks because you want to allow that collagen to lay the tissue down so you can help it rebuild. But if someone had a knee replacement in 1999 and their scar is really, very keloid or hypertrophied, you can do it to kind of help break up the scar tissue. This worked really well for the teens. They really liked it. A lot of them put the piece right on the chest where the port was, and it was very beneficial. So if someone had a scar right up the middle, like right up the bicep, you want to put one piece of tape right over it, and then you want to put like 3 or 4 really small, narrow strips, kind of zigzag to help break it apart. That was a good question. I was going to get to that as well. So we did a little bit with the shoulder. Wow, it's already 7:53. Time is flying today. You guys are great. I'm going to show you guys the knee and the ankle, and then we'll kind of lead an open discussion. So same thing.
Can I ask you, Michael, real quick, could you do that on your Achilles too?
Yeah. Okay.
Okay.
Anywhere there's a scar, you can.
Perfect.
So for the knee, so a lot of people have knee pain. If we should have asked a poll who has knee pain, it probably would have been 100% because everyone has knee pain. Same thing, we cut a Y strip, right? We want to figure out where is the knee pain. So one, we want to go, the biggest thing, this is a good view. So here's my kneecap. Some people's kneecaps ride up, some ride low. You want to put the tape right around the kneecap. You don't want to put it on the kneecap because when you flex your knee, it'll pull the tape. You also don't want to have this hairy legs because it'll hurt to take it off. So I always used to put the tape on. For this time, I'm going to save myself the crying when I take the tape off the knee. I'm going to show you kind of over it. But if my pain is underneath, I want the pieces to kind of go like this. If the tape is on top, you start the fan here and you put right on top. A lot of my patients also have subluxations of their kneecap. They sublux medially. So what do I want to do? I want to stabilize it. So if someone dislocates inwards, I would put the fan here and I would bring the tape all the way around on the outside. I would bring this one from the top all the way around on the outside, and I would just stabilize it. The best thing to do for knee pain is really start the tape on the top, like right by the quad. Take this one piece, bring it all the way around right underneath. Take this piece, put it all the way around right underneath. And I have these on the YouTube channel, HemoDoc, so people can kind of use that as a reference. So you have the tape kind of right around, And then if someone has additional discomfort, let's say on the inside of the pain, you take an eye strip and you start one piece of tape and you pull with a lot of tension right around. And that'll give you ultimate support. And for anyone who's limping or has any discomfort, this will provide you literally immediate pain relief, which is huge, because if someone's right knee hurts and you're not flexing it, or you're leaning more to your left, then you're going to go from right knee pain to right knee pain and left hip pain. Then you have right knee pain, left hip pain. Then you have back pain or maybe ankle pain. So we want to try to prevent these compensations as best as possible. The last thing is really the ankle. So the ankle, I love using eye strips. A lot of times the patients get the pain right in here. They get swelling right on the inside or the outside. So what I like to do, same thing we did with the wrist, bring your foot up, bring your foot down, bring it in, bring it out, bring it in. See where you have the pain. Most of the time, people have pain when they bring their ankle up, which is called dorsiflexion, and they have pain right in here, which is right in the joint. And then they don't bring their foot up, so they kind of drag their foot or walk very flat-footed, which leads to a lot of arthritis in the ankle, and that's why people with hemophilia or bleeding disorders get kind of self-fusion of their foot and ankle. So what I would recommend is, if that's the case, put your foot into dorsiflexion, start one piece of tape from the bottom of the foot, go right around, start it from the other side, go right around. So you're kind of making an X on the ankle. For bottom of the foot, you can use the tape, just kind of wrap it around the bottom. It will be very beneficial for plantar fasciitis. Achilles tendonitis, the same thing. People get pain in the back of the Achilles. You can use it for that. So that's pretty much, the other thing is sometimes people ask about back pain. The best thing for the back is to just put like an X right on the back. So someone asked if I could show for the ankle. I will show it. So if you guys can cut like 2 pieces of tape. So to make things a little bit quicker, you can actually take one big piece of tape, fold it in half. And from there, around my edges, and then you have it still cut in half. And now I got 2 pieces. It's a magic show. So from here, you want to take, so here's my ankle. It's up. I'm going to rip one piece off. Put one piece on the bottom, right? And now what I'm doing is use your right hand to kind of hold, and your left hand pulls. And then you go up. Okay? And then same thing the other way. I like to make a little cross. One hand here. So I'm kind of holding. So as you guys see with my right hand, I'm pulling up, and now I'm going across. So I used to have ace bandages on the ankles. What happens with the ace bandage, your circulation gets cut off. And my foot used to turn purple. I would wear it for an hour. And then I would have more pain and swelling because I lost circulation. And it's very hard to ace bandage yourself, unless you have a lot of experience with it, to do it appropriately so you're doing the right amount of pressure. With an ankle brace, you keep your foot straight. You lose mobility. And it's also very difficult to put your foot in a sneaker. So someone asked if I could redo the ankle. These videos are on YouTube, which, we take a lot more time to kind of go through them. So you can follow them step by step. But does anyone have, maybe we could take some time for like open discussions of questions.
Hey, Mike, can I ask you a quick question? We had 2 people ask.
Yeah.
We're not sure of the chicken wings in the back, like in the back of your back. Could you tape those?
Yeah. So it depends. If the pain a lot of the times is on the inside, I can't tape myself that. So I don't think unless your arms can kind of, that you wouldn't be able to do on your own. So I can't really demonstrate that.
Yeah.
So what you would do is really just take it. It's really wherever the pain is. So if it's tightness, you don't want to use a lot of tension. So a lot of times I'll put like one strip right up the middle to the right of the shoulder blade or to the left of the shoulder blade to help reduce some of the tension. You could also put your arm across your body,
Mhm.
put those muscles on a stretch, and then put the piece of tape up. So that was the first question. But yeah, you could pretty much tape anything.
So does that make sense to you, Barb and Shannon? Did that answer your question?
Yes, thank you.
Okay.
And then I saw someone else ask what the YouTube channel is. It's called HemoDoc, HemoDoc. And just keep in mind, these are random people recording me, so they're not professionally done.
And then Mike, someone asked, so had Achilles lengthen after injury, so the ankle isn't what hurts, but the muscles. And she's wondering, or maybe the tendons in the shin get inflamed and sore. Would I tape just straight over them?
Yeah, so if you had an Achilles injury and you're getting pain in the shin, it's probably because those muscles in the front of the ankle were not strengthened right away, or maybe they're just still a little bit in a weakened state. I get a lot of runners who have shin pain, right? So what you want to do, if your pain is on the inside of the shin or the outside of the shin, usually a lot of times with tightness. So what I do for my runners, I take a piece of tape. I start on the very, very beginning of the foot and ankle, and then I just let that piece of tape come up right in the inside of the shin. Same thing on the outside. Take the piece of tape on the bottom of the ankle, right by the bone. I just let that piece of tape come up on the lateral aspect or the outside part of the shin. If it feels swollen, what you could do is use that fan strip that we did for the forearm, make it a lot longer, start it on top by the knee, and just kind of let that fan come all the way down to the bottom of the foot to help with swelling. But some exercise, like if the shins are bothering you, try some heel walking, like walking actually on your heels to help strengthen the front of the shin muscles.
Okay. How about anything for sciatica that radiates down the back of the leg to the calf?
Yeah, so if that's like a pinched nerve
Mhm.
coming from the spine, what you could do is try the X tape on the back. Again, I can't really show that on myself, but
Mhm.
you would need somebody to take one piece of tape from the top of your spine, put it like this, like right across the tailbone, and then another piece right across in the bottom. If it's really being pinched by that, then you can try some piriformis stretching. So bring your leg kind of up and across. You could take like a little tennis ball, roll on it right in the hip joint. That can help. But if somebody has that pain, I would definitely go see like a PT or a chiropractor that knows what they're doing. And they can reduce that tension. But you could try the X tape along the back.
Mhm. Chris, did we miss any other questions that you see?
Not yet. Someone just
Lauren,
mentioned
he's in
taping
New
safe for children.
Jersey. Oh, sorry. His practice is in New Jersey. Lauren was asking where your practice is. You're in Old Bridge, New Jersey?
Yes, I'm in Old Jersey. I get people that come to me from Pennsylvania and New York because honestly, like not even like hemophilia, just most physical therapists in general, it's they're not spending time with their patients and patients just kind of get left alone. And our practice is very big on one-on-one therapy. So when people come to see us, like I have people with hemophilia that come to me from New York, Pennsylvania, and these are people that have had pain. Come to Alabama. I'd love to come to Alabama. Get me out there. That's the one state I haven't been. A lot of people just don't spend the time with their patients, but also, understanding like what I need to do for somebody with a bleeding disorder, just giving those specific exercises and regimens and stuff like that. So, if anyone has questions or wants to make the trip, I've worked with a ton of hemophiliacs, Von Willebrand's, in our office. I'd love to help anyone. Yeah, you can use the tape for back pain, like the X. If the X is for support, if you have a lot of tension, like right up the spine, let's say you were like shoveling snow or lifting something in your back super tight, just use two pieces right up the middle of the back, not on the spine, but to the right and the left of the spine. That can kind of help reduce some of the tension.
Mike, someone asked, when you do the Achilles, is it Y up or Y down?
So if you wanted to stop it from, if it's super, super tight, what I would do is take a Y strip. If this is my heel bone, I would put this right like on the heel, like maybe a little bit underneath. So this is resting underneath my heel bone. This is right on the heel. And then those 2 Ys just kind of go on the outside of the calf muscle. That's to help it relax from firing.
Great.
And then another thing you could do is take like the eye strip and just pretty much start it here and wrap it right around the heel bone. Because a lot of patients get pain right in that kind of heel. That can definitely help.
Okay. And we missed a question that was earlier. Her question was, thank you, Gretchen, and we appreciate this. Will it work for my 8-year-old daughter who has a knee joint bleed right now, and they have her not weight bearing? She has a knee brace and elevate.
Yes. So that's the thing. That's where I personally think that nobody should ever be non-weight bearing, because you lose, unless someone has like a completely blown up joint. But everyone should at least be doing early motion, trying their hardest. But the biggest thing is we want to control swelling, right? Mm-hmm. So if the knee bleed is, can that person, can I see them? So can they describe it a little bit?
Would you, is Marisol?
Yeah. She's actually swimming right now. I have her in the spa, my daughter.
Show me. Get you.
The bleed is the swelling is completely down.
Gotcha.
She just has the knee brace, which is like the worst knee brace for an 8-year-old. It keeps
Where
sliding down.
Point your knee.
Oh, let me point in mine because she's in the pool. Sorry.
Point it.
What was that?
Like, show me where the knee pain is.
Well, she doesn't complain a knee. It's on the right knee. It's swelling here, and in the back of her knee back here. It's still a little swelling.
Gotcha. So what I would do, if the pain is there, I would take the Y strip, put one
and then
here.
Have her on this brace, which is like,
yeah. So with the brace, it's like it's very like cumbersome. So with the tape, put the piece, the Y strip, put it around underneath her lap, then take one regular strip, and if her pain is here, put it right around. That's going to give her support, and it's going to feel much better than the brace. And now
she has a PT appointment tomorrow. I'm going to ask if they have that tape there, so if they can help me with it.
Yeah, good. You're not in New Jersey, are you? Are you in New Jersey?
We're in California. We're in Santa Barbara.
Oh, 6-hour flight, no problem. Yeah, so they should definitely be able to tape, but I would definitely try to get that knee moving. Swimming is great because that's going to help, reduce the swelling, help with the fluid retention. She could try like backward walking in the water, help her glutes kind of work a little bit, forward walking, things like that. But the tape helps everything. It's really good to use. It's really good to use in the acute stages because when you're in severe pain, that's when you start compensating. The goal is that the tape takes away that severe pain.
Okay, yeah, I'm just afraid that she's gonna get locked knee because she just has it like this. We do exercises for bending knees, the glute ones, and then the ankle pumps. That's when the doctor they want us to do for her right now. We've been doing that since day one when she was in the hospital because she was in the hospital for 5 days.
Yes, you guys are doing the good stuff. You're actually moving. Like sometimes you were on bed rest and then we lose so much strength right away. And it's like, we can't, people that are it takes 6 weeks to strengthen a muscle. It takes 3 days to lose strength if you're just in bed rest. So we try to get as much motion as possible. At least that's my personal recommendation. Unless someone can't tolerate it, then you don't proceed. But even like doing like a leg raise, get that fluid going, get that knee moving. So definitely the tape you can tape her or have the PT tape her and she'll notice, like she'll like the tape a lot more than the brace. It'll feel more supportive because it'll be more direct right on that spot because the braces are so big, like you just generally do the whole. It doesn't
even stay on. As soon as she moves a little bit, it slips all the way down to her ankle. Like it's on her knee and then it slips down.
Yeah, that's why I'm glad you're saying this because the tape will 100% help her tremendously, much more than that.
Okay. Thank you.
Someone said this is one of the best things I've seen for. I didn't read the rest of it, but it sounded good.
Yeah, it's good. Do you put the tape over the kneecap?
Yes, you don't want to go right on the kneecap because what happens then is that if you bend, it'll start crumpling up. Okay. You want to put it around the kneecap. They say capsulate it. Like if, right around the kneecap because that will give it the support, but not on the kneecap. Because then when you bend, flex, extend, it'll wrinkle a little bit.
How about how long should areas be taped for? I heard 5 days, but if pain and discomfort persist, should it be reapplied? And if so, how long is it safe to continue to tape for?
Yeah, so you can always tape. I mean, I'm constantly taping my right wrist because it always hurts from the job that I do. Usually when my patients come in, if they're taped, I'll tell them, take it off the day before coming back in. So if you're taped for 4 days in a row or 5 days in a row, take it off at least 12 hours, let your skin breathe. There's no specific amount. Like you can take the tape off and then reapply right away. But you want to give your skin a little bit of time to breathe just so there's no like irritation or rashes. And then you can reapply right away. So when I'm like in a lot of pain or discomfort and there's something that I need to tape, I'll tape it on. When it starts kind of peeling away, then you could take it off and then reapply.
not
Donna
sure.
said elbow contracture release.
Yeah.
I'm assuming she's asking if this can help with that.
Yes. So it depends. If it's the bicep that's tight, you want to inhibit it, which means not put a lot of tension. So start the tape on the bottom, let the Y strip come up. But it could be like that could be a flexion contracture, or if it's an extension contracture from the tricep, you can put the tape here, let the piece kind of come off, right? To inhibit the tricep. And then the one thing I didn't touch on is you could actually tape the elbow. So if you have pain here or here, put the piece of eye strip right around it. And if that feels better but still painful, then make it like a little X, like you have one piece here and put another piece on top. And that's what I did for my patient with, my buddy with hemophilia with the severe elbow contracture. He literally went from having his elbow like this to like that right away, just from having the tape on, because it was able to help relax the muscles that we need. Now that's something a little bit more, might not be the easiest thing to kind of figure out because you need, a little bit of knowledge of the anatomy, where to put the tape. But it could definitely help the contractures if applied appropriately.
Barbie was asking, is there a tape available to those who are sensitive or allergic to some or most of adhesives?
Yeah, they have latex free. They do make those. I don't know the specific brand. That's something like, you would Google or put on Amazon, but they definitely make those 100%.
Awesome. Lauren asked, do you only use one piece of tape for the knee?
So that's a very good question. It depends. So if someone just has pain right underneath, you could just put one piece of tape and the pain could be gone. Or you could use the Y strip and the pain could be gone. Or you could use the Y strip and 80% of the pain is gone. And then you use another strip across, then 90% of the tape is 90% of the pain is gone. And then you can use one more piece and then 100% of tape. So you can use one piece. You can use two pieces. They're really the best taping, which again is hard to kind of do via Zoom. But look on the YouTube channels. I actually use 4 pieces of tape where I put one piece across, then I do a Y strip, and I put an I strip right on the bottom. But that would be, hard to kind of follow along. So look up the YouTube video on that, and that'll definitely be helpful.
Just real quick, this isn't a question or anything. For those who didn't receive their tape and they did indeed sign, I just saw a comment from Amy. I just checked your tracking right here. I mailed everything out at the end of last week, 2-day, 3-day priority with everything, supposedly writing, Wednesday, Thursday, the latest for this call. Amy, yours had to receive yours on Saturday for some reason. So 3-day priority ended up being a 7-day priority. Gotta love USPS right now. So if you signed up and you confirmed that you wanted K-tape, I sent it to you, but USPS is a little delayed. Thank you. And yeah, we did send it. Thank you. Thanks, Joan.
Yeah. Hey, one last question, Mike, and I know we have to go. Someone said, thank you. This is great. So everything you've mentioned applies to children, or is there anything that doesn't apply to them? Mainly concerned about how long they can have it on for.
I'm sorry, say it again. It mainly applies to children, but can you just, I'm sorry, repeat that one more time.
No, forgive me. So she wants to make sure that anything you said, you can use it for kids too, right?
Exactly.
And-
Yeah, it's great. 2-year-olds or I had a 3-year-old coming in with a lot of unspecified pain. They were limping. I put the tape on and kind of went away. For young kids with scars, it can definitely help with that. So you can use it for any age. The only thing I would, trouble is if you put it on an infant and they're not speaking and you can't tell if they have an allergic reaction. So what I would do is maybe take a small piece of tape, put it like right around like on their forearm, somewhere where it's not so sensitive, leave it on for 3 hours, and then take it off and see if they had an allergic reaction because they're not, talking yet. So, that's what I would recommend.
Okay. Mike, I had someone ask, would you be willing to telemed for a consult?
I don't do telemed.
Mhm.
We did it during the pandemic for like a little bit
Yeah.
where, I would just say, just message me on Facebook and I'll get back to you. I won't do an official telemed, like bill your insurance or stuff like that.
Yeah.
Where does that person live? Where do we live?
That's not, Julie, I'm not sure where you live.
Arizona. Nice. So get me to go to Arizona, do a little presentation out there, and then we can do a live telemed. But yeah, just message me on Facebook, whatever questions you have. When I'm in the clinic Monday through Friday, I'm like, very busy throughout the day with patients. So I wouldn't do like an official telemed that would, but we would, send me a message and I'll do what I can to help you out.
All right, cool.
All right.
With that, I am going to put real quick the link for the virtual evaluation for tonight in chat. I'm also going to send it to everybody who is here via email. Put that right there. Also includes the 2 chances to win gift cards next week for our next session. I'm going to go ahead and hit the share real quick for the rest of what we got lined up for the rest of. So that's Mike. Hi, Mike. You look good in that picture too. Next week, we will have Dr. Amber Federizo on the topic of sexual health and intimacy. The Ladybugs, our rares, and our VWD will be invited for that. So be on the lookout for the Zoom link next Thursday at 3:00. After that, week 7, mental health. Week 8, being inhibitors. Week 9, being wellness, eating yourself healthy. And those are the next 3 Thursdays for the next 3 weeks. And then I'm not going out of the spring and summer agenda yet. That's secret. And with that concludes our call for tonight. Thank you guys all for coming out, and the huge round of applause for Mike. Huge thank you to I know Christina Booth's on the call. Thank you to Culturals for providing the tape. Thank you, Susan. I saw that earlier. The tape that we sent out is indeed latex free. She has a huge severe allergy and severe allergy to latex, and she's wearing it, so it's latex free.
Thank you guys for your time. It was great.
Thank you, Mike.